Hello guys, so today we will be discussing NUGENT score and I'm Dr. Santosh Gupta. So we will be considering what is NUGENT score, how it is utilized and what is the importance of NUGENT score. So we're starting with what is NUGENT score. So NUGENT score, this is a microscopic scoring system that is used to diagnose bacterial vaginosis. Okay, so that is one of the infection in the when there is disruption of the normal vaginal flora, that is by bacterial vaginosis, and in order to diagnose that we use NUGENT score. Okay, and it is basically a gram stain based vaginal smear assessment. Okay, so when the patient has sign or symptoms of bacterial vaginosis, we will take a swab from the posterior wall of the vagina, and then a smear is made on the glass slide. Then it is further gram stained, and then gram stain is analyzed under microscope, and the score is given, and based on that assessment assessment is made whether the patient is suffering from bacterial vaginosis or not, along with considerable sign and symptoms. So now, in order to understand that patient is suffering from bacterial vaginosis, you must also understand that what is the difference between the normal vaginal flora and the disturbance in the normal vaginal flora, that is known as dysbiosis. Okay, so in the normal vaginal flora, the main bacteria that we will find in the normal vaginal flora, that will be lactobacillus. But if there is disruption of this normal vaginal flora, then it will be inhibited by less of lactobacillus and more of other bacteria present, that can be Gardnerella, Bacteroides, or Mobilengus. And the common organism that will be seen in the normal vaginal flora, the species of lactobacillus being Lactobacillus crispatus and Lactobacillus jenseni. Okay, normally because lactobacillus ferments lactic acid, that will lead to the acidic pH of the normal vaginal flora. So we will encounter a pH of 3.5 to 3.8 to 4.5. But in case of dysbiosis, that is disruption of the normal flora, the pH will be more of a higher side of the acidity, so it will be more than 4.5, which is diagnostic criteria used in Amsel's criteria as well for the bacterial vaginosis. Okay, now normal flora being protective for the female, because it prevents other growth of other pathogenic organisms in the vagina. Okay, and dysbiosis, this favors growth of other pathogenic bacteria as well. Considering lactic acid formation, so as we know that lactobacillus will ferment sugar and will produce lactic acid, so this will lead to higher acidic pH, and it will be lower in dysbiosis. Okay, now there will be since this is one of the side is being normal vaginal flora, so patient won't complain of any smell. But in case of dysbiosis, because of the breakdown of amines, so patient might complains of fishy odor. Okay, now when a patient complains of a normal, of a clear or white discharge, don't consider it as a diagnostic point for bacterial vaginosis, because this can be also seen in normal vaginal flora as well. Okay, but if the patient complains that the discharge is quite thin and it is grayish white in color, then you must suspect case of bacterial vaginosis. Okay, so being the normal vaginal flora being protective, so there will be increased low risk of infection, but this infection will be increased in case of dysbiosis. When the normal vaginal flora is encountered in the scoring system, it is given score of 0 to 3, and if it is a disruption in the normal vaginal flora, then it is given a score of 7 to 10. Okay, now what does NUGENT score assess? Okay, so when we do microscopy of the gram stain prepared on the slide, right, so there are mainly three types of bacteria that we can analyze. Okay, all of them being the gram negative bacilli. So first being the lactobacillus. So if during the gram stain we see the long rod shaped gram negative bacilli being colored, then this is most probably lactobacillus, which is a good bacteria because it is a normal flora. But if we see short gram negative bacilli being colored, or gram negative cocobacilli, which is of pink color, then this is indicative of Gardnerella or Bacteroid, which is a kind of harmful bacteria. And if the small gram negative bacilli is of curved shape, then it is of indicative of Mobilengus. So it is again the cause of bacterial vaginosis. So this can be assessed under the microscope while examining the slide. Okay, now based on the assessment of the slide, the scores are provided. For example, if the flora is normal, so if you see a normal pink bacilli with a long cylindrical shape, then it is normal, so it is around score of 0 to 3. But if you see small and short bacilli at the same time, so this is a score given a score of 4 to 6, depending upon how much the amount is present. Like if large number of long rod is present and short number of small rod is present, bacteria are present, then it is given score 4 to 6. And if there is large number of short bacilli present or curved bacilli present, then it is given a score of 7 to 10. If this score is more than or equal to 7, then the bacterial vaginosis diagnosis is confirmed. Okay, so what is the role of NUGENT score actually? So this detects the imbalance in vaginal flora, which gives the criteria for the diagnosis. Okay, it differentiates between the normal flora and the bacterial vaginosis. It helps in early diagnosis. Okay, now remember that in pregnancy it is quite useful, because NUGENT score if from the NUGENT score diagnosis of bacterial vaginosis is made earlier, bacterial vaginosis causes preterm labor in pregnant females, and if it diagnosis is made early, then it is quite helpful, because patient can be preventing from having preterm labor. So that is a quite important complication you must remember from the point of bacterial vaginosis. So that's all guys, thank you.